So I just wanted to give a bit of a larger introduction to Dr. Wicklow because she's done a lot of extensive work in the gender dysphoria population. So Dr. Wicklow is currently the pediatric endocrinologist at the University of Manitoba and is an assistant professor in the Department of Pediatrics and Child Health section of Pediatric Endocrinology. Dr. Wicklow is also one of the founding members of the Gender Dysphoria Assessment and Action for Youth Clinic since 2011. Good Day is a multidisciplinary clinic providing comprehensive care for Manitoba's child and adolescent transgender community. Dr. Wicklow is a member of the CPATH and of Winnipeg's Trans Health Coalition. Dr. Wicklow has been providing care to transgender youth since 2008 and more recently has been the main pediatric endocrinologist providing health care to transgender youth in Manitoba. Dr. Wicklow has been interviewed as an expert in trans health by the CBC, Winnipeg Free Press, and has served as a consultant to the government in Manitoba in the development of the new Vital Statistics Sex Designation Forms. So Dr. Wicklow will now introduce me, and then we'll get started.
Dr. Simon Trepel is a child and adolescent psychiatrist employed by the WRHA since 2006, currently working for the Manitoba Adolescent Treatment Centre as a co-leader of the Day Hospital program. Dr. Trepel helped co-found the Gender Dysphoria Assessment and Action for Youth, or Good Day, program in 2011. Good Day is a multidisciplinary clinic providing comprehensive care for Manitoba's child and adolescent transgender community. Dr. Trepel is a member of the CPATH and of Winnipeg Trans Health Coalition. He has received specialized training in trans health by seeing clients in the Good Day Clinic over the past 5 years. Dr. Trepel has also attended the International WPATH Conference in September of 2011 and the 2012 Canadian CPATH National Conference. Dr. Trepel has been interviewed as an expert in trans health by the CBC, Winnipeg Free Press, and most recently served as a consultant to the Government of Manitoba in the development of the new Vital Statistics Sex Designation Forms. He has been asked by the Ontario government to provide the same consultation. Dr. Trepel has presented on trans health to numerous audiences in both academic and clinical contexts, as well as What's Up Doc, the lecture series for Manitoba's child and adolescent psychiatrists. He has no pharmaceutical relationships to disclose and is excited to speak with you today. Dr. Trepel is always excited.
And that was why we needed the bio for that one joke, Eric. Thank you for that. So we have something else up here. I'm just going to close it and I'm hoping, there we go. We'll start from the beginning, I guess. In the beginning there was light. No, I'm kidding. So welcome everybody. The microphone is not cooperating, but that's okay. This is about transgender health and about the kids and teenagers we see on a weekly basis for now through our Good Day Clinic, but it's also just about the topic in a more general form. So please enjoy the show. We have a few objectives today. First being recognizing the differing presentations of children versus adolescents and adults with gender dysphoria. And there is a big difference in the presentation of these two populations, children and adolescents. Understand the assessment process for youth with gender dysphoria at our Gender Dysphoria Assessment and Action for Youth Good Day Clinic. You can see we've started with some repetitive themes just because we want you to remember a few things that you take away from this presentation. We also want you to learn about treatment options for patients with gender dysphoria and their families. And this would include psychological assessment and psychotherapy, endocrine evaluations, hormonal interventions, as well as surgical procedures. So we'll start with some epidemiology. That's where most people start. And we don't really have lots of data yet. There aren't a lot of meta-analysis on the transgender population in any age categories. There are various estimates around the world, and they range from everywhere from extremely low prevalence in the United Kingdom to over 1% in areas like New Zealand. The way the data is being collected, however, is not uniform, and so we're going to really need to take a relook at the data, and it's possible that even the 1% may be an underestimate. De Kuyper and colleagues in 2007 reviewed 10 studies and found prevalence rates, as you've seen, one in roughly 1 in 10,000 to between 1 in 50,000 for trans females, and between 1 in 30,000 to 1 to 200,000 for trans males. And very little data is known about the child and adolescent population. We do know prior to puberty, we see more natal males presenting than natal females, but this number essentially equalizes. This 1.2 is the ratio of more males to females as teenagers, and it essentially normalizes as adults. A brief history of some of the terminology of gender dysphoria started in 1923. with the term transsexual, which was coined by Hirschfeld. In 1953, transsexualism was a commonly used term at that time by Benjamin. But it was really in 1960 where Hooker and Stoller kind of coined the sort of classic phrase, independently, I might add, and almost simultaneously, the concept of gender identity. And it was 1980 where the DSM-3 took a sort of swipe at trying to quantify and clarify and label this diagnosis. And unfortunately, adding in the word disorder has sort of caused a lot of provocation and a lot of inflammation in the LGBT community. So the gender identity disorder diagnosis was maintained for the next DSM in 1994, but it was then changed from gender identity disorder to gender dysphoria in 2013 in the DSM-5. And this really was to reflect the fact that it's not a disorder to have a differing sense of your own gender identity. And many of us in the room, some of us are classically masculine like myself, but many of us are on a spectrum of what masculinity means. And so I think that we all know that there is no one agreed upon gender sort of ideal, and that we're in fact all on a spectrum, and we're actually very much mixes in many ways. So really that was what the DSM-5 tried to capture in that moment by calling this a gender dysphoria, around the mismatch between who you've been assigned at birth to be as far as your gender and who you feel like you are on the inside. So gender identity very simply is a personalized, internalized sense of their interpretation of gender. So this is an extremely subjective experience for most people, and it's also very unique and very, it's just very unique and independent. So what's interesting about this is gender identity can actually encapsulate either a sense of being female, a sense of being male, a sense of being a mix of both, or in some cases and in some individuals, neither. Neither affiliation, and we're now seeing more and more kids and teenagers in this other zone that we don't really see a lot of kids we don't really talk a lot about. This is one of my busiest slides, so bear with me. Most of us have a very different image of what is feminine or masculine, and we all value different aspects of these terms. Gender role is the behavior and the script of the person designed to express an affiliation with feminine, masculine, neither or both traits and labels. And I think we've all seen that term a few times before. I actually have to operationalize this. These are things I memorized, and now I have to kind of actually think about when I'm seeing kids, because they become really pervasive aspects of how they live. Sexual orientation is, of course, a person's erotic response tendency. Transgender, therefore, becomes an umbrella term for all individuals that cross, challenge, or transcend traditional definitions of what it means to be male or female. Genderqueer is a newer term for some of you in the room, and this is a term that sort of encompasses individuals who don't actually prescribe to any particular gender or sexual orientation. And there are some areas in the States actually where even the pronouns have been changed quite radically. In some areas of California, there are many genderqueer individuals who reject him and her and she and he, and they prefer pronouns like they, them, person, z, and her.